we have someone here who might have some ideas about how to pay for it that I'm very interested in hearing. Please give a warm welcome to Ramona Massachi.
All right. Hello, New Jersey. My name is Ramona Massachi, and I'm about to explain the most significant part of our movement for healthcare as our God-given right: funding. I hope you can all take this information in, because it's the one thing in government that separates you and Medicare for All. I always envisioned a society where we can take care of ourselves and each other. I always knew that this was possible, but my spiritual awakening was not going to have empirical evidence that our society must create this and that it is possible. In 2018, I started to research, how is Bernie getting away with all the proposals? I went to the source, and I found his economist, Stephanie Kelton. The information I found by peer-reviewed academic journals is completely in alignment with my vision of justice, our vision of justice. How many of you have heard of MMT?
Love it.
Modern monetary theory is a lens that describes the monetary system and how federal funding works. We've always been told that our federal taxes fund the federal government. We've been told we can't have Medicare for all because there isn't enough money going from us to the government. That we need to tax someone to fund it. I'm going to shed some light on that right now. The government is not cash constrained. They need to create the currency first before they can tax you. The economic model and our understanding of it has changed. Decades of research from top economists have found a more accurate model. Within your own household, you would need to earn money first, right? And then pay for your groceries and utilities and hopefully take a vacation. The government's budget does not run like your household. It must spend first and then tax. That model is called STAB. Tax and borrowing are secondary to spending. Taxes do not finance the spending. By the time the government sells bonds, the spending has already been financed. There is nothing stopping the federal government from creating money and giving it to somebody. They do this all the time with government contracts to weapons manufacturers. They can do this as well to fund Medicare for All, comprehensive health care. The government can't run out of money. It cannot go broke. It can always purchase whatever is for sale. This is very important. Your federal tax dollars do not fund government spending federally ever. Congress is the issuer of the currency. When they decide to fund the military, Social Security, health care, all of that money is new money. MMT calls it public money that Congress just types into a budget. The federal government's ability to spend dollars is not under any constraints. We are a monetary sovereign nation. We have the fiscal capacity to fund the American people. What we really need to pay attention to is inflation. The resources that directly affect healthcare are numerous. We need to invest in doctors, nurses, specialists, hospitals, clinics. Healthcare is directly tied to higher education and the training of these people and the infrastructure to build the hospitals and clinics. We will be creating jobs to serve the needs of everyone. The middle class will grow enormously with all of this employment. We must force our politicians to invest in us. When politicians and pundits talk about how are you going to pay for it, tell them it's the same way we pay for everything else. Do not let them pretend they do not understand. They all understand. We are so very lucky because behind the scenes, heterodox economists have been invited to the House and the Senate by both parties for years now. Do not let them pretend they need to tax you to pay for any of it. Us MMT activists and economists used to sit around and ponder, is Congress ignorant? Maybe they just don't know. I can now confirm they know. Every single one of them knows. Even Alan Greenspan, who is the chairman of the Federal Reserve, understands. He said, and I quote, "There is nothing preventing the federal government from creating as much money as it wants and paying it to somebody. It's well over time the federal government takes care of us instead of the billionaires that fund their campaign. This is all political will, not funding. Comprehensive federally funded health care, Medicare For All, is deflationary. We will be cutting the massive administrative overhead of private insurance. When we are able to address people's health care before they end up in the emergency room or a life-complicated health issue, then we spend less on health care. What about the deficit, you might ask? Have you ever heard of people saying, we're taking money from our children and passing our debt on to them? That the government needs to get their fiscal house in order. That we need to balance the budget. The monetary deficit doesn't matter. The deficit that matters are the ones tied to the lack of health care for over 87 million people that are uninsured and underinsured. The real goods and services that are tied to money is what matters. The infrastructure and human infrastructure that can facilitate those needs. We can no longer be fooled into the fear of the big, bad national debt. The national debt is a historical record of how many dollars are currently being saved in the form of U.S. treasuries. Spoken by Senator John Yermith of Kentucky, who is chairman of the House and Budget Committee on C-SPAN. The debt is the total investment the federal government has made over the entire history of the country, minus taxes. Attempting to balance the budget is austerity, and austerity is murder. We need to consciously increase the deficit by funding health care and the human resources that are necessary. There is no long-term inflation deficit problem. It's an artificial constraint. There is a horrific myth going around for a long time. Reagan started it. He said we owe money to China. We do not owe money to China. China does not hold our debt. China voluntarily buys government bonds for the interest dividends. It's quite literally an investment. that can be paid back overnight if they choose to cash in. We are being played by both parties. They use the lack of this information against us. Every single time we try to balance the budget and go into a surplus, we end up in a depression or a recession. We have done this 6 times in our history. Stop the insanity. The reason why the government perpetuates this lie is to keep you desperate, so that you would do things that you would never normally do. Think of all the millions of dollars in public money we give as grants and subsidies to the pharmaceutical industry to do research for our health. Then they abuse us, so we can't even afford the medication. We will not be able to get healthcare under control if they continue this abuse. We must make sure the pharmaceutical industry is not allowed to price gouge us anymore. We fund them with our public money. They are here to serve us, not for us to make them billionaires off of our hard-earned paychecks. So you may say, why not just tax the rich? I'm all for taxing the super wealthy. They use the dollar against us, buying our politicians, putting out ads to smear people that actually understand this knowledge. Look how they're attacking Nina Turner. The fact is, every time we link our government's bills to any form of taxation, it either falls on the middle class that are just trying to get by, or you propose to tax the wealthy, and the bill hits a brick wall. Tax the super wealthy, but there is absolutely no reason to tie what we desperately need, health care, to that bill. Create a separate tax bill. So you can imagine my rage when politicians that fully know better talk about the rich paying their fair share, or they propose taxation in their policy. Don't let them destroy Medicare for All with this decisive evil nonsense. The government can afford anything for sale in the United States, including medical service. Medicare for All means all invoices are paid through Medicare using dollars Congress has appropriated. It removes the insurance liability of employers and adds money to the pockets of all Americans. You may ask then, what are taxes used for? They should be, but they are not currently enforced to limit the power of the wealthy from owning your government. They can also be used to prevent inflation. But a better method is to pay close attention to the resources that are needed and increase those resources before inflation rears its ugly head. It's also a tool to keep you needing the currency. Doesn't that just piss you off, concerning how much the middle class is taxed? How does that relate to Medicare for All? We need to plan. Every district, every state will need to map out all the resources that are necessary to make sure we have a successful program. Evaluate how many people are in your district that are not insured or underinsured. Then figure out how many additional doctors, nurses, hospitals, and so on we need to address for the needs of these people. Do not allow the federal government to tell a hospital that emergency care costs $4,000 a night when it actually costs $6,000 a night. Figure out the actual numbers and force Congress to pay the bill. That is why we have government, to tell them what we need. Do not let them underfund your health care, because I can see the spin already. See, we told you Medicare won't work. We just can't supply what is necessary. That's bullshit. Have your local universities in your area do the research. Come prepared. Now you know what I learned just a few years ago from Bernie Sanders' chief economist advisor, Stephanie Kelton, and dozens of heterodox MMT economists. Dr. Kelton also served on the Senate Budget Committee. It's now your responsibility to learn more. We have a lot to address, but how we pay for health care is not an issue. Hold the politicians in your community accountable. This is one piece of knowledge that will change how everything works and get you the health care that you deserve. If you want to learn more about MMT, please read Stephanie Kelton's book, The Deficit Myth. There are online resources as well. Real Progressives, Macro and Cheese, Money on the Left, Modern Money Network, Deficit Owls, MMT Podcast, Activist MMT. There's so many resources out there. There you will find the heterodox MMT economists and the life-changing work that they're doing. Solidarity, New Jersey.
Thanks very much, Ramona.